So I just went down the Affordable Care Act rabbit hole, and I'm genuinely shocked that Americans are not more outraged about this entire thing. The Affordable Care Act subsidies that the Democrats are requiring to extend in order to reopen our government are subsidies that are paid with taxpayer. Obama said you must use the Affordable Care Plan or pay a fine or get insurance elsewhere. You must have insurance. You must use Obamacare. It will be affordable. And then it ended up not being affordable at all. So we had to subsidize the cost of it with taxpayer money that is paid directly to insurance companies who are causing the driving up of healthcare costs in the first place. This is such a scam. And people aren't outraged. Like, it sounds so noble that the Democrats want people to have affordable health care, but Obama forced people to have affordable health care that wasn't affordable at all, so taxpayers have to pay it, but we pay it directly to the private insurance companies that make health care unaffordable. Can someone clarify if I'm missing something? Because this is wild.
Obamacare has now been around for 15 years, and the promise was that it was going to save us dramatically on our healthcare spending and make us healthier. And if you look at 2010, for a family of four, their premiums were about $13,000, and they had about $3,000 to $4,000 in deductibles. Now you go to 2025, that has jumped to $35,000, about a $5,000 to $6,000 deductible. What's happening now is we have what's called functionally uninsured patients. That means they have insurance, they think that they're okay, then they get sick, they go to the ER, they present their magic insurance card, and they find out they have a $5,000 deductible. So that means they have to pay $5,000 for the first dollar of coverage. Now the ER for sure is going to eat up that $5,000 deductible. What that means is patients now have ongoing medical debt. So has Obamacare saved us money? No, unfortunately not. What it has done is made the system very, very complex. You've had the growth of very small to moderate size insurance companies to huge insurance companies. There's now 7 insurance companies that are in the Fortune 500 right now.
Insurance is the ultimate scam. Like, I feel like it is. I mean, if I didn't have to have it because I'm going to be penalized by not having it, I wouldn't have it. But anyway, I've been seeing people walk in their truth and tell their stories. So I'm going to tell mine and see if any of this has happened to anybody else. But back in August, Cooper needed tubes. So the ENT sent over our information to the place where the procedure was going to be done or whatever. And they called and was like, hey, yeah, it was like $13.97. And I was like, God, dog, like she was like, oh, you haven't met your deductible, so you have to pay blah, blah, blah. And I was like, okay, I get that. So she was like, are you going to pay like right now? I was like, no, I'm going to pay the day of. I'm not paying you over the phone. And she was like, okay, well, it has to be done before the procedure. I was like, okay, I'll pay it when I get there before the procedure. Like, I don't want to pay you right now. I'm not giving you my card information over the phone. She's like, okay, fine. So we get off the phone, which irritated me anyway, but I called back because I just didn't like the number. I was like, $13.97, like that is crazy. So, because what's the point of insurance? Like, what's the full price then? So ultimately that is the full price because I had not met my deductible. So I'll call back a few days before the surgery, and I was like, hey, my daughter's having surgery, blah, blah, blah. You gave me this price. So she looks up, she's like, yeah, that's the correct price. I was like, okay, great. Can you tell me what the cash price is? I don't want to run this through my insurance because I'm not going to meet the deductible by the end of the year. So I might as well just pay the cash price. So can you tell me what that cash price is? Do you know what she told me? Because you have insurance and we know you have insurance, we will not allow you to pay cash price. How you going to tell me I got to use my insurance? And the cash price was $600 and some change.
I was trying to avoid surgery, and they sent me to a hospital here in Oklahoma City. I called the hospital and I said, how much is it going to be? And they said, well, do you have insurance? I said, I do, but I just want to know how much you charge. Well, it depends on your insurance. I got to tell you, that's one of the dumbest things I've ever heard. Why would it depend on my insurance? Like, how much do you charge for this service? Well, I'm gonna have to have someone call you back. So they called me back and they said, based on my insurance, it'd be $7,000 something. I said, well, what if I just paid you the day of the surgery, the procedure? She said, oh, self-pay? Yes, $1,200. Yeah. Yep. So I paid them $1,200 and I still have the email. They did the math for me. It'll be $7,000 something. It's gonna be discounted because of your insurance to this much. And then your deductible and co-insurance, you'll be out of pocket $3,000. or you can just pay us $1,200 that day and we'll call it good.
Insurance bill's cheaper when I tell them I have no insurance. Okay, let's break this down. Most people just assume if you have health insurance that your bills will be cheaper, and that's not the case. Almost all the time, it will trigger for your rates to be even higher on your medical bills. That's because when you show up to the hospital and you show them your insurance card, they are no longer billing you, they are billing your insurance company. That's a massive company with deep pockets for change. Because of that, doctors and hospitals will charge inflated rates for these visits. The reason for this is they know that the insurer is going to negotiate, but they're still in the end going to be paying big money. So what if you walk in with no insurance? This is called self-pay, and no matter where you go, if you walk in and tell them you're self-pay, you will be getting a big discount. A lot of times it's 40 to 50% off of the bills, and sometimes it's up to 75 to 85% off of these bills.
Help you. So I think there's a mistake on the bill, but maybe you could help me out. We got a bill, and then we realized that you guys didn't have our insurance, so we sent you the insurance, and it looks like the bill went up.
It went up?
Yeah, the first bill we got without the insurance was $600, and then the second one was almost $1,300.
Okay. Yeah, so that the first invoice you received, that's a discount that you receive if you're uninsured. So you're not eligible for the discount since you are insured. And so the bill was $2,342.14. We billed your insurance. Your insurance only paid $1,078.85.
Can I go back to the discount without the insurance?
No, sir, you're insured, so you're not eligible for the discount.
If I go cancel my insurance, am I eligible for the discount?
No, sir, because we checked eligibility and you do have active coverage for data service.
Oh, I needed to cancel it before I got the service to get the discount.
You're only eligible for the discount if you're uninsured.
Okay, so I'll get cheaper health care if I'm uninsured.
If you're uninsured, you're eligible for the discount, correct?
Is this common? Like I pay for insurance and I end up paying more out of pocket because I pay for a premium? That's wild.
This is just a new law that started 2024, AB 716, and the law is if you receive a discount if you're uninsured.
Okay.
So when we first send a invoice to the patient, we bill them as if they're uninsured. If you're insured, unfortunately, you're not eligible for the discount.
Okay, so just if I have the incentives straight here, if I want to pay less for medical care, I should cancel my insurance if my daughter needs life-saving medical care?
I'm not sure. I don't know, sir.
It's this.
You should cancel your insurance. I'm just letting you know that discount's only for patients who are uninsured.
Okay, that is special. That is a special law. So there's no way to put that discount onto an insured person. Only the uninsured people get that.
No, correct.